Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio, and I'm real glad that you could join us once again. I'm going to have a conversation with Mr. John Temperato. He's CEO of RDD Pharma and what will be Meters Biotechnology. And he's joining us on the program this morning to talk about GI diseases, talk a little bit about current treatments, and why there are still unmet needs for diseases such as celiac and other gastrointestinal disorders. Welcome to the program, Mr. John Temperato. Thanks for taking the time.
Well, thank you for having me, and I look forward to discussing our narrative and everything that is GI.
Great. Now, a bit of background about yourself for our listeners. I did, of course, say that you're CEO of RD&D or RDD Pharma, and you're going to start a company, or have you already started a company known as Meters Biotechnology?
That is correct. I'm currently CEO of RDD Pharma, a company headquartered in Tel Aviv, which is in Israel, obviously. We are in the process of finalizing a merger with two other companies, one called Innovate Biopharmaceuticals, which is a public company headquartered in Raleigh, and Naya Rare Diseases, which is a private company headquartered in California. We are bringing these three companies together under the name Meters Biopharma and hope to close that transaction by the end of March, the 1st of April, or sometime in April. We will be a NASDAQ-listed company with the ticker symbol NMTR.
Now, is your company going to focus on a specific GI disease or many?
Yeah, great question. So the first thing I want to go back and say is the new name of the company, or the combined company, will be Meters Biopharma. And the reason that I wanted to bring the name back up is that it speaks to our dedication and singular focus. 9 meters is the approximate length of the GI tract. So I think that's important to know about us and what we speak for and how we truly do have a one-tract mind. In terms of our dedication to the space, we really want to focus on 3 areas within the GI tract. So we'll be agnostic along those 9 meters, but we won't be agnostic as to the patient populations that we want to serve. We truly want to focus on rare patient populations, orphan patient populations, and those populations that have true unmet needs. So we don't want to be the 15th drug for heartburn, if you will. So we really want to focus on unmet needs within the GI tract.
Why are there still these unmet needs?
Yeah, a great question. Again, there's so many big disease states with multi-million patient opportunities within GI. So, for example, like IBS-D, which is the diarrhea predominant component of IBS, or IBS-C, which is the constipation predominant component of IBS. So when large pharmaceutical companies look at the revenue opportunities, they rather focus on millions than tens of thousands, where we want to focus on tens of thousands and those under 200,000, but we will also focus on those with true unmet needs. So that's where we go with celiac, for example. Celiac has about 3 million patients in the United States, but there's nothing approved for celiac disease other than a gluten-free diet.
This company is going to be the first phase 3 drug candidate. You don't have to go through any other phases. You're focused on phase 3.
Yeah, that's correct. We are the first company to get a drug to phase 3 for celiac disease. There are other companies that are currently in development with drugs for celiac, but they're are farther behind us, at least 2.5 years behind us, and there's nobody who's ever made it to a large phase 3 trial for celiac disease. So we're currently enrolling 630 patients for this phase 3 trial and have over 100 sites up and running for enrollment. So we're excited about the prospects.
So what type of a cross-section of candidates from these 600 are we looking from? Are we talking advanced stage symptoms? Are we talking candidates through markers such as genetic markers, things of that nature?
Yeah, that's another good topic to bring up. But one of the nice things about celiac disease is that there is a absolute test to determine whether you have it or not. It's a genetic link. And celiac patients have a specific HLA class gene variant, a class 2 gene variant. And the reason that's important is that so many GI diseases, and I mentioned IBS earlier, are diseases where you eliminate everything else, and then you say, okay, because you've eliminated everything else, it has to be IBS. And that's how you get to that. It's called a discretionary diagnosis. The nice thing about celiac disease is that you can absolutely take a genetic test that says you have celiac or you don't have celiac. So it's also nice for the patients to absolutely know that they have a gluten sensitivity, and they can do that through a simple test.
Now, having a gluten sensitivity, are we talking drugs for maintenance or drugs for preventive measures, or a combination of the two?
Yeah, well, it's probably a combination of the two. The other issue with gluten is that there's gluten in just about everything. So you could have celiac disease, you could be on a gluten-free diet, but there's traces of gluten in just about everything. So, for example, there's gluten in lipstick. There is gluten in anything that you would put on your chapstick, for example. So if you're a man or a woman, and you have a celiac disease, then you could be exposed to gluten. There's gluten in toothpaste. So there's trace amounts of gluten in just about everything. And what we're trying to do is derive a solution by which these trace amounts, and we can help people not only with that, but as well as with some the ability to have them modify their diet and take this drug 3 times a day prior to each of their meals, so they can obviously alleviate some of the symptoms that are come along with having celiac.
So how much of a role does the board play in the development of this new company, this 9 Meters?
Yeah, so the board of the director of the new company, it was really important that when we're building a company, that you have a board that's very supportive and have deep roots in the industry and the disease state. So in bringing the company together, we really formed a board that has a deep operational experience, deep investor experience, and deep GI experience. So, for example, I'll be on the board. I've had 10 to 12 years of experience with a very large pharmaceutical company called Celiac that was focused on GI. Mark Sergo, who's our chairman of the board, brings with him a fantastic reputation and background. He was actually on our board at Celiac. Worked at GlaxoSmithKline and was a CEO of another public company called BDSI. The founder of Celiac is on our board. We have Nissim Darvish, who represents OrbiMed, our lead investor, who's a very important institutional and very, very sophisticated investor and supportive investor. And then we have Steve Lomas, the current CEO and chairman of Innovate. So we bring a broad base of experience, both financial, GI, and investor, and operational, most importantly.
Give us a little bit of insight into what we can look forward to as far as some drug candidate milestones, and then give our listeners a website where we can learn more.
Sure. So in terms of milestones, what we'd like to see over the next 24 months is, I mentioned this celiac trial earlier. We really like to get to the interim readout of the phase 3 trial and see what we have from a statistical sizing standpoint, and that's a very important readout for us. And then the other lead program that we have is for short bowel disease. It's a GLP-1 for short bowel disease, which we haven't spent much time on, but we will be able to initiate that study and have the top line results within the next 12 to 18 months, both which are key inflection points for the company. In terms of a website, currently you can go to RDD Pharma or you can go to Innovate Biopharmaceuticals. Eventually, once we merge the companies, we will have 9meters.com. So that's the numeric number 9, meters.com. That'll be up and running the day we close. And before we end, I want to make sure that everybody realizes this is most importantly when you lead a biotech company or pharmaceutical company. What's best for shareholders is what's best for patients. What's best for patients is what's best for shareholders. We will always do what's right by patients. They will be first of mind and top of mind in everything we do. At the end of the day, the most important thing we can do is improve the lives of patients. Patients not only don't want to survive a disease, they want to thrive at the end of it. And that's what we truly hope for and what we'll be positioning ourselves to do.
Absolutely. John, thank you so much for joining us on Health Professional Radio.
Thank you. Have a nice day.
You as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.